Hey everybody, welcome to PermanenteDocs Chat, and thank you all for joining. June is Pride Month, as you all know, with all the rainbows everywhere. I love it. And today we'll be talking about LGBTQ care here at KP, and I'm very excited to be joined by my friend and colleague, Dr. Ali Tao, a nuclear medicine physician here at Southern California Permanente Medical Group. So if you have questions, drop them in the chat. If you're on Facebook Live, drop them in the thing below. We'll try and get to any questions you have as we go. We'll keep this fun and high yield and hopefully informative. So can I call you Ali? It feels awkward.
Of course. My friends call me Ali, and you are my friend. So yes.
Excellent. So tell everyone who you are and what you do.
All right. Hi, everyone. I'm Ali Tao, she, her pronouns. I'm a nuclear medicine physician down here in Kaiser Permanente in Southern California. And I'm proud to be SBC, San Bernardino County. And Alex and I, we're colleagues here. And it's nice to have him as a buddy here on campus. And I feel better knowing that, he makes everything better. So,
I know about that.
And so, but I'm a nuclear medicine physician, and so I'm the physician in charge of nuclear medicine at SBC. I'm also serving as a regional lead for nuclear medicine as well. But I'm also a clinical assistant professor at the Kaiser Permanente School of Medicine. I know, Alex, you're a faculty colleague as well. You're doing amazing things, and where I'm serving as the nuclear medicine specialty director for the medical school. And I'm also on the Equity, Inclusion, and Diversity Advisory Committee. And I'm very proud of that. And, and trying to do it right. And, and of course, sometimes it feels like 3 steps forward, 2 steps back. But guess what? I think, remember, the EID is a journey, not a destination. So we're always in motion, always learning.
Absolutely.
Stay humble.
Well, tell us about your personal, your professional interest and work within the LGBTQ community and LGBTQ care as well.
Sure. So not to bury the lead here, I'm a proud trans woman. I actually transitioned 8 years ago, and that was after being at Kaiser Permanente for 8 years. And that's something that I never thought that I would ever do. I didn't think that was something that was possible. And it's just, I've received more support, from my KP family than I ever could have hoped, imagined, or felt like I deserved. And because of my KP family here, especially at SBC, I'm here 8 years after transition, living my best life, just the kind of indescribable freedom of being yourself, and also being in a place where, where where you're celebrated for being yourself. So, I thank my SBC colleagues, my KP family, for creating a safe space, a brave space, I like to call it. And so that we can all be ourselves completely. And but I'm hoping that we can, and I guess my hope and my passion is to create safe spaces everywhere else. Like everywhere else outside of KP. I mean, there's still places that within KP where I think we still have a lot of work to do. But the whole point, I want to create safe spaces. And part of being at the medical school is I'm really hoping, kind of charging even our medical students as they journey on. So they create safe spaces, systems that are, that are safe and affirming, and that are growing. And so until I transitioned, though, I didn't think much about LGBTQ care, because again, I never think I was going to transition, but a lot of it wasn't on my plate, but it's something you learn after. You never realize how much privilege you have until you lose it. And that's the one thing that did happen. After transition, never knew how much privilege I had, but I never knew what a big deal male privileges was until it was gone. I didn't realize how much having cisgender privilege was until it was gone. I didn't know how much it was to have hetero privilege until it was gone. So all of a sudden you find yourself on the outside looking in. Before you always felt like you had a seat at the main table, and with there, you're not aware of, you just know the people who are at the table there. You're not aware of all the people who aren't there. It's only once you're not there, you're on the outside looking in, you're on the sides of the room, that you're aware of all the other, groups that don't have a seat at the table. And that's when I realized that's what I'm fighting for here. My own trans community, but also for every other community that's minoritized, that's marginalized. And so that's my passion. Yeah, Nukes is I like because I'm a nerd. And I have an engineering and computer science background, but my real passion is to advocate for marginalized communities, but especially the community that's near and dear to me, my own transgender, non-binary, the gender non-conforming community, the gender diverse community. That is something that gets me up in the morning. It's one of those things that just fuels me. And that's my deep passion. And I also know that I want to make sure everybody has a chance to live their best life, just like I am. And I also understand, again, about privilege, because even in the trans community, I have more privilege than anyone else that I know. I'm a physician. My wife's actually, having my family survived intact through transition, actually thriving. My wife's internal medicine physician at Kaiser Riverside. Shout out to them. And this year will be our 25th anniversary in September. And we have our 3 boys, 13, 15, and 18. Again, that's part of the privilege, but also having, being physician, having the knowledge, having the resources, having the financial resources, being able to transition. So I transitioned in 2014. There was hardly anything available. There was only thing available was just bottom surgery. We're talking about like kind of genital surgery. And I think a lot at the time was there wasn't any trans folks really informing trans care. It was cis folk. And I think for a lot of cis people, I think the misunderstanding is that genitals equals gender. And there's nothing further from the truth. And gender affirming care takes on so many forms, and every transition looks different. And for me, so what gives people dysphoria is different for each person. And so everything that I had to go through back in 2014 was all out of pocket. It's been $50,000 out of pocket.
Wow.
Then after I kind of got my feet underneath me, I said, all right, game on. Basically I said, because having a chance to live your best life, that's not a privilege. That's something that's a right, just a chance to be your best self. So I said, regardless of your resources, that, I want to make sure everybody has access to all the care that I had, so they can be their best selves, and they can go out there and make a difference in the world, and they can be who they were made to be. And so that's been my driving force. And by 2018, and after kind of like really some really difficult conversations and sometimes very heated ones, and also having a target on my back, by 2018, I'm really proud to say that everything that I needed to transition that paid out of pocket was now a covered benefit within KP. And
so thank you so much for, first of all, being here and sharing your story. And then also obviously this is personal for you, but your passion and your ability to help others also is, including myself, to understand and to learn better, is amazing. So you did touch on one point. I want to kind of keep moving here, if that's okay. A lot of physicians still are just confused about terminology, things as basic. So help us understand the difference between gender, between sex, and between sexual orientation, because a lot of people sort of get those confused. And if you could help, I know you have some great ways for us to remember. So if you could kind of share some of those tips you have for our physician audience.
Sure, I got some tips for you that you will never forget, even if you wanted to. So anyway, so how about this? Gender is what's between sex is what's between your legs, and gender is what's between your ears. Meaning that we're talking about sex, we're talking about someone making a fairly quick determination after you're born and saying, all right, taking an assessment, looking at kind of external, kind of looking at phenotype and whatever you got, and said, okay, All right, making a determination, kind of an external determination. But as we all know, that's not who we are. Who we are is we have innate gender. And so that's what's between the ears. That's what, and it takes a while before, people can say, this is who I am. For most folks, they just said, yeah, there's alignment, but we know for many, many folks, that's not the case. And we're going to talk about how about the difference between gender identity and sexual orientation. All right, here's another one you'll probably never forget is this. Like sexual orientation is who you want to go to bed with, and gender identity is who do you want to go to bed as.
I like that. So gender is sort of, again, the gender is between the ears and how you feel. Do you feel like a male, a female? Do you feel non-conforming? Sex is sort of what we see externally or what we associate externally. And then sexual orientation is who you're attracted with. Is that sort of a good summary?
It. You got it. I couldn't have said it better myself.
I have great teachers like you to teach me this, so I appreciate it. So tell me, how can physicians and other healthcare workers create a safe place for patients to feel comfortable talking about some of these really difficult questions, and just creating a more open and welcoming and inclusive environment?
You know what? I think the first thing is to learn. Is that. I'd say a couple of good places to start. I think like pflag.org, hrc.org, good places, good resources. And also if you want to know about gender affirming care, going to Fenway Health has an entire, educational series, and they have a lot of content that's up to date. It's tremendous. And I refer a lot of people to, I use it myself. And I think so kind of getting educated, but also being, listening to the stories. Having a heart for the community above all else, knowing that people in this communities have had, even for myself, have very difficult journeys and that are worthy of our respect. And so listening, I think listening above all else. But then I got to doing that work, but the one thing that's most difficult for trans people is access you kind of say in a clinical setting is being misgendered, and also being, misnamed, is being, called, not being called their affirmed or chosen name, and we're not having their affirmed pronouns used. Those are things that we're really working hard on. And I'm hoping that, that's just become standard practice. So the one thing you can do, and for just speaking as a patient myself, and on behalf of the community, I think every trans person that kind of walks in the hospital kind of expecting there to be some traumatic experience. You're almost expecting it. You also know that something bad is going to happen. Something's going to jump out. So what can we do? How can we make a safe space? And how do we signal to the community, the gender community, that we are a safe space? So again, signage matters, forms matter, bathrooms matter, and just the way our customs matter, even from every touch point, from driving into the parking lot to going into the hospital, from being greeted at the door to going to reception, making sure all those things that we're mindful that that we are affirming our gender community. Yeah. And I think a lot of it too, even as a physician, for you to signal that you are a safe person, that you've done the work by putting your pronouns on your badge and actually using your pronouns, like, hi, I'm Dr. McDonald, like he, him pronouns. Like for me, I say, hi, I'm Dr. Ali Tao, she, her pronouns. So normalizing the use of that, and just, sometimes we're just looking for safe people. So guess what? Even those badge wheels we've been giving out on campus, but on your name, there you go.
You can see my rainbow caduceus I have on my name badge.
Thank you. Thank you for that. And thank you for everyone who identifies just as a person who is an ally, who is safe. And that's how you'll create an environment where people, you'll create a safe space, a brave space where people can be fully vulnerable.
I think for me as a primary care doctor, it's something that I wasn't necessarily trained to specifically. And so I've had to go seek out extra trainings. And I feel very supported here at KP. There's extra training modules you can do to be, an LGBTQ sort of certified physician or qualified. But then also you have one patient who has a positive experience with you. And I've amassed a lot of LGBTQ patients on my panel, I think, because they talk, obviously. And I think it's really important to make sure that you see people for who they are and you listen to them as well, just like you said too. And little things like having a rainbow caduceus on my name badge. People pick up on those things, and I never realized the value of that, of just the subtle cues of showing that it's a safe space. And I'm really proud to work at KP in an organization that does all those pieces as well too.
As I am as well. Proud to be KP. Proud to be
KP. Yeah. Well, tell us what are sort of some common questions that you think patients or family members may ask when it comes to gender or sexual orientation as well, and how can physicians maybe prepare themselves for answering some of those questions or helping patients sort of get to the right resources?
Again, I think it comes down to kind of familiarizing yourself. I think there's always the fear that we're going to say or do something wrong. I think that's so that people don't engage as much, or people just like, let's hope we don't have to talk about it. But it's just this, we're just talking about someone, we're just sharing stories. And so it's not a scary thing. And also, like people fear saying the wrong thing or not knowing. I think a lot of us, even in the LGBTQ community, we know that sometimes our provider may not have all the answers. But of course, what we're looking for is someone who's willing to go the distance with us and partner with us to kind of go on this journey. I think above all else is a heart to say, I'm here with you. I'm here, for the long haul. I will not quit on you. I will be there. I will be your support. I will be I'll be your family. Kind of as we walk through this, especially for a lot of, LGBTQ folk, especially without any family support, maybe social support, we become their family, and it makes an enormous difference. And so I think not being afraid to not know, and but being willing to say, hey, I'm going to look that up. I'm going to go do work. And guess what? That will never be offensive, and that will be taken in the best way possible. So not being afraid, but a lot of it though is showing that you're open-hearted, that you're open-minded, and that you're giving space. So, your LGBTQ member, they are fully seen and they're fully heard. And that,
I remember one experience when I was first sort of learning how to provide, sort of equitable care, I guess, and open care is I had a transgender patient, and I didn't know how to ask. And I even said, I really apologize. I don't know how to ask this. Do you still have a vagina? Do we need to do a pap smear? Right. So very sort of simple, straightforward questions, which we're not trained to ask those. And sometimes asking for forgiveness I've been shown a lot of grace from my patients, but then also they sort of understand, and it helps open that conversation. And then I feel like the next time is easier, and the next time I know how to ask those questions in a more appropriate way. And so sometimes asking for forgiveness, but showing that you're trying, I think makes a huge difference. And I never felt comfortable doing that until I was able to talk to a lot of my friends and some of my patients as well.
And absolutely, you were talking about, especially let's talk about body parts too. It's one of those things where I think you show a lot of understanding, you show a lot of empathy when, first of all, we ask people how they want to be addressed. We ask them their name, we ask them their pronouns, but then we also kind of, even before we go into anything, we always explaining exactly why we ask. Because I think for a lot of LGBTQ folk, they feel like they are curiosity people, and people will ask questions and feel like, just because, is this really relevant to what's going on in the visit? But also one thing, especially when talking about sexual history, doing inclusively, it's just when you talk about those things, even ask up front, hey, what words do you use to, for your body parts? What words do you like? What words do you prefer? What words do you want to use? So again, trauma informed, knowing that there's a lot of folks who don't want to, let's say, like trans men, a lot of them don't want to hear the word vagina. They don't want to. And so there are other ways of saying it. And, and certainly a lot of learning materials, Fenway Health, we can talk about, and actually, it's like there's a script almost that you can follow, but a lot of it is kind of like knowing that people have had a traumatic experience, they've had trauma. How do we not go there? And so a lot of it is just sort of in the very beginning, like, how can I make this as minimally as minimally traumatic as possible? And how can we do this in a way that's most affirming, that you feel affirmed, that you feel that, you know, that in the way that, you know, that because what it does, it helps a partnership, that helps us keep things open. And, you know, and that's when the best healthcare happens.
I completely agree with you. When that patient-physician relationship is sacred, and feeling comfortable to have those conversations and to create that space is so valuable in making sure that nothing interferes with our ability to care for our patients. Because that's why healthcare is complicated, because everyone is different and everything is different, and every physician-patient relationship is different. And so navigating those waters can be certainly challenging as well. So this is such a wonderful conversation. We could go on and on and on, but we want to try and keep this short and high yield. So I'm just going to ask you my last question here. Sure. Tell us what makes you most proud to be a Permanente physician? Most proud. There's going to be a couple answers.
Okay, you know, I was talking earlier about KP family is the fact that we rally around each other, the fact that we really do become each other's families. We spend more time with our KP colleagues than even with our own families at home sometimes. And I think and we're all here because we believe in the work that we're doing, but we all believe in each other. And we have the opportunity to care for each other and be parts of each other's lives. That's what I'm proudest of, is that I can say we are family, and family is what got me through the most difficult time of my life when I was, you know, and people reaching out and letting me know that we got you. It's going to be okay. And guess what? And no one, you never gonna ever have to worry. We're never gonna quit on you. And that's sort of, and that's what I'm proudest of. And I want everyone to feel that way. I want everyone to feel like anyone in our KP family, that they're seen, they're heard. I want everybody to know that they matter, because they make me feel like I matter. Yeah. And and so to me, that's what's most precious to me. That's why I'm proud to say, I'm KP.
Awesome. Well, thank you so much for joining us, and thank you for your vulnerability and your leadership and your passion for this work and to educating all of us. We're all better because of it. So thank you so much. I really appreciate your time.
Well, thanks for your time, Alex. And again, it's always awesome hanging with you. So.
Always a pleasure. So join us for our next PermanenteDocs Chat. Is going to be Thursday, July 7th at 1 p.m. Pacific. We'll be speaking with Dr. Sedler, who is a dermatologist from the Southeast Permanente Medical Group, where we will be discussing summertime skincare. So make sure you put your sunblock on this weekend. And we'll talk to you all soon. Thanks so much, everyone.